I think nurses are so well suited for psychedelics, and we bring so many skill sets that other disciplines don't. And I don't think any one discipline has it all, but I think we bring a really important piece of the puzzle. And if you think about it, nurses are with patients in non-ordinary states of consciousness, sometimes every day. If you're a hospice nurse or working in labor and delivery, if you're in psych, if you are working with patients, coming in and out of anesthesia, patients with delirium, so many reasons why somebody could be in an altered state, or even just shock trauma, emergency nursing. And nurses often are with patients for prolonged periods of time, offering their caring, healing presence.
Welcome to the Integrative Nurse Coaches in Action podcast. My name is Nicole Viano. I am your host, and I'm also a board certified integrative nurse coach. And today we have another amazing guest, another inspiring nurse who is taking nurse coaching and moving it forward in her own unique way. So we're going to welcome Dr. Stephanie Van Hope. She is from upstate New York in the Catskills, and she is calling herself a holistic psychedelic nurse educator. And she is taking nurse coaching and combining it with psychedelic and the holistic nursing aspects. And I know this is a really up and coming topic for nurses, for nurse coaches, for humans in general. And so I'm really looking forward to having Stephanie on the podcast. So let's welcome her.
Thank you, Nicole. Happy to be here.
Yay, I'm happy you're here too.
Mhm.
I was just thinking back to probably maybe about, I don't know, 7 years ago or so when we were at the Integrative Health Symposium, I think in New York City. Yeah. And I interviewed you way back then. It was just like a flashback to that. So, um, and a lot has changed since then.
Mhm.
So we're looking forward to having you share a little bit about that. And before we even get to some of the exciting things you're doing with psychedelic nursing, we'd love to take a trip down history lane and learn
Sure.
a little bit about why you even became a nurse.
Okay. So I became a nurse about 13 years ago. I had studied psychology in college. I had a bachelor's in psychology. I knew I wanted to be in the healing, helping professions. That was always clear to me from a young age. My parents are both therapists. My mom is actually a psych NP. I never really was that drawn to nursing, though. But through her example, I did kind of catch on that there's a lot of things that you can do within nursing. I think that's kind of what one of the reasons I ultimately came to it. But I was kind of doing some soul searching. What do I want to do? Do I want to get an advanced degree in psychology? Do I want to study medicine, become a doctor? Do I want to become an acupuncturist or a yoga teacher, or what in this world is right for me? And eventually I settled on nursing because I think there was something about like the hands-on getting down into the nitty-gritty with people that I knew was calling to me in some way. And I think in retrospect, it was maybe calling to me because that was something I needed to learn from, like a part of myself that I needed to strengthen, that really practical aspect. But also because I knew that you can take nursing in many different directions. And so I felt like it was a good pathway to just open doors into different possibilities. So I went back to school. I got a second bachelor's in nursing. And I've always known that I probably wouldn't take a traditional path. I thought maybe I would go into psych. Um, it didn't end up going in that direction, but I've definitely yeah, I've definitely kind of zigged and zagged. I started off in acute oncology, and that was a great learning experience, very challenging, and I knew pretty quickly that wasn't the right environment for me. I loved working with people in intense situations. I loved working with families. I didn't mind working with people who were really sick or dying, but I did mind that it was inside of a approach to care where we didn't really acknowledge that aspect of it and didn't have room as much for the psychosocial and family aspect. And so that was hard for me. So I went from there to hospice. I was in hospice for about 5 years, and that was awesome. I loved hospice. I loved how the center of priorities shifts as a nurse in hospice, and there are medical aspects. There's a lot of medications and a lot of pain medications and different symptom relieving medications, and you have to have good assessment skills, but it's also equally as important to have meaningful conversations with patients and families and make sure they're getting the right food that they wanted. And if they want to have a drink before bed, to make sure they have that and get them outside and, all of those more human-centric things that really should be incorporated into all areas of nursing, but unfortunately tend to be more prominent in certain areas like hospice. So that was a great fit for me. And then I then I discovered health coaching and took the Inca course, which was an awesome opportunity. I was with Barbara Dossi and Susan Luck, so I had the good fortune of studying with them, and that was lovely, along with some other great colleagues and mentors. And I didn't become a practicing coach right away, but a few years later, I went back to school for a doctor of nursing practice in integrative health and healing, which is a really unique specialty offered by the University of Minnesota and really aligns with all of my values and passions. So I was doing that program. And around that time, I had the opportunity to work as a health coach for an insurance company telephonically. So I did that for 5 years, which was great. I loved that experience too. That was really an opportunity to meet people where they're at, so to speak. Um, because sometimes I would be reaching people who like wouldn't otherwise talk to a therapist or even make much time out of their day for themselves, but I would be kind of getting in there and just having like some people long sessions and some quick like laser coaching sessions and trying to really I really enjoyed the populations I got to work with through that. So that was wonderful. Then after I graduated, I moved into a position here in my local community as a nursing professional development practitioner at our local hospital. So I do nursing education and professional development. So that's kind of like my general nursing trajectory, but at the same time, I've been interested in psychedelic healing and psychedelic medicine and sacred medicine. When I first started nursing, I had the really good luck to get introduced to some folks at NYU Medical Center who were doing research in psilocybin, um, which is like the synthetic version of mushrooms, magic mushrooms, and using that at end of life anxiety, or people with a cancer diagnosis that had existential anxiety. So I had the opportunity to be a guide for that study, which was really wonderful as a brand new nurse. And that was just an awesome experience. And I've continued to kind of follow that path at the same time. I was part of a spiritual community for like 13 years or so, where we studied sacred traditions from many different cultures, but really especially North and South American cultures. And so I kind of immersed myself in more that ritual and community approach to healing. And I've been kind of following psychedelic research and development, and have done some writing and speaking on it and teaching. And that's kind of where I am today. And I have developed a course for nurses called Return to Roots, a self-development course for psychedelic inspired nurses with my colleague Angela Ward. And well, I'm sure we can talk more about that, but that's kind of my little history.
Woo! It's an amazing history. I'm always so fascinated by the stories of our nurses because they have, like you say, some zigs and zags, zigs and zags in their history. For you starting off in psych and then recognizing I'm going to go into nursing, a second degree, and watching your mom and as a nurse practitioner in psych, and then realizing, oh, hands-on is where I want to be.
Mhm.
Yeah, and then just all of your experience with oncology, and then moving into hospice, and then recognizing the real connection of holistic pathways, and that was likely there all along. It's not like you just recognize it one day, but maybe more connected to it, right?
Hmm.
And then always having this, you mentioned the sacred medicine. And I love that term. And I'm hoping you can touch on that a little bit more,
Hmm.
just defining that a little bit for our listeners, but just moving into that and realizing that you really have a passion for rituals and sacredness and psychedelic nursing, and then creating a course now and like using all of these tools that you developed all the way through your life to get to where you are today.
That's
Whew.
true. Yeah. I feel like when I started off, sometimes nursing and my other interests kind of felt far apart. And it's
Yeah.
been a journey for me to like build that bridge. And now I do feel like it's more integrated, which is a nice feeling.
Yes. Oh, it is a nice feeling. It's like you finally like connect them,
Hmm.
like you say, building the bridge and connecting the pieces so that you become more aligned with who you are and how you want to show up in the world, and using all of the experiences and the pathways that you've created through your life. Okay, so that's exciting to create a course. I do want to go back to nurse coaching though, because you mentioned getting to do your training with Susan Luck and with Dr. Barbara Dossi, the creators of nurse coaching. So I just want to ask just a question of like, what stands out for you as being one of the most impactful things that happened for you because of this training
Hmm.
in nurse coaching?
Hmm. Well, I did love working with them. I feel like they just were such a great embodiment of presence and had such a vitality to them and such a care for everybody who was in the program and an interest in us, which was really good role modeling for how we can be there for our clients. Um, I think for me, nurse coaching was giving me a foundation and permission to do a lot of the things that I already knew how to do in a sense, or had had some inclination and skill towards. Basically, just really getting curious about people and um, really wanting to offer my caring presence for them, witness their stories, and see where their story is going and how I can support them. I mean, that felt like such a natural longing for me, and nurse coaching just gave me like the toolbox and the permission to do it in a more organized and effective way, and to feel confident in that. Um, so it's like on the other end, I feel like I have a skill set rather than just like this longing for a certain way of being with people.
Mm, yes. Yeah, these are skills and tools that we have and we have an inclination towards, as you mentioned, but we just didn't know how to put it all together and have
Yeah.
it make sense.
Yeah.
And integrative nurse coaching allows us to do that, integrate
Mhm.
nursing theory with it, different theories with skills of coaching, and make it make sense. And
Exactly.
confidence, too. That's the other thing you
Mhm.
mentioned. Yeah, the confidence to do the work. Yes. And then so I'm curious also about the telephonic work.
Mhm.
So maybe just maybe one story that kind of stands out for you of maybe of course a client who you can't mention their name, but
Yeah.
just kind of a story that affected you positively.
Oh gosh, yeah. Um, like I mentioned, with that work, it was a kind of a unique way of coaching people. It's not like somebody's coming to you because they found you on the internet or wherever and they resonate with you and they're gonna pay a certain amount of money and invest their time and energy into working with you. It's more like you're cold calling people, getting clients, offering them a free service. And so some people weren't as invested and the impact wasn't as large. And that was true for a lot of the clients. And that was the harder part of the work. But then some people you reach and they're like, this, they this type of coaching is exactly what they needed at exactly the right moment. And you can really change their life or help support that change in their life. And there's one in particular, there's probably, there's a dozen or so clients that became really special to me and that, I'll carry with me. There's one in particular that she was a young woman I think she was just in her late teens when I started working with her, and she had been hospitalized for depression. She had had a suicide attempt. And so I started coaching her, and for the first, gosh, I feel like at least a year, we'd have maybe monthly calls, and it was there was almost no responsiveness. Like I really didn't know what was going through her mind on the other side. I was glad that she was getting on the phone with me, but like there was just very little engagement, and it was kind of almost felt like talking at a wall at sometimes. And I was always trying to just engage her more and get a little bit more from her about what she's going through, what's important to her. So we were doing that work little by little over time. And something shifted and she started to open up, and like it was literally like this doesn't always happen, but it was literally like just like a flower blossoming. And she started to be really interested, more engaged. She started to be really interested in health, like losing weight, eating healthy. And then like we kind of went more into emotional issues. And it was like, I know a lot of it was because she was doing work on her own, but I also know that this was towards the end of our journey together. She said, like, that me working with her was really a turning point. And she was like, all those things you said to me in the beginning, like, it was like I didn't hear them, but I did. And then over time, like, I would start to hear them in my head. And then over time, things started to shift slowly. And now she's like, an Instagram influencer. You know, she puts out videos on healthy eating and like among other things, among style tips and things like this. But and like just totally, totally blossomed into somebody who was really invested in her health, in her wellness, her well-being, into her spiritual life, and then even to the point of wanting to share it with others. So that was like, you know, one of those really satisfying clients.
Mm,
And I
very.
did find in the work that like I really enjoy working with young people, like people at that just kind of that transition into adulthood. Worked with a few clients where I feel like that's a good niche for me.
Mm, a great story. And the impact of coaching over
Mhm,
time,
mhm,
right? Over
mhm,
time. And I think of the stages too, you know,
mhm. Yeah.
that here you are just calling, like you say, cold calling to people.
Well,
And they're like, who, what is this? What is
yeah.
coaching? And then moving them through the stages of decision making and supporting themselves. So that sounds like a fun job,
Mhm.
being a nurse and being a nurse coach in specifically.
Yeah.
So okay, so now you're into, I'm going to say you're into, which is not really appropriate. Now your interests have aligned more towards the sacred medicine, psychedelic nursing, and creating a course. So tell us a little bit about, maybe I would love for you to define sacred medicine
Sure.
for us and our listeners.
So there's different terms that people use for these types of medicines, and the three of the ones that I kind of use somewhat interchangeably are psychedelics, entheogens, and sacred medicine. So Um, psychedelics, I use that term mostly because it's what most people are familiar with. They know what that means. It's like there's a public understanding. Basically, I mean, psychedelics means mind manifesting, but it's something that creates a shift in consciousness or shift in lived experience. And so that's one term that we do use and is in the title of our course. But entheogens um, is a little bit more closer to my heart because it means to create God within and or to experience God within. And I really do resonate with that sacred aspect. And it's amazing to me that these plants and fungi and molecules can engender an experience for a lot of people of the divine or of deep meaning or of something very profound, profound insight. And so then sacred medicine is just a more plain English way of saying entheogens and also kind of resonates a little bit more with my understanding and background of indigenous traditions. So I like the term sacred medicines probably the most, but people don't always know what that means.
Yeah, I wasn't familiar with it, but I'm, honestly not familiar with this world that you're in. So that's why we have you here, so we can learn from you and absorb some of your learnings, and have insights into possibilities for each of us as we're exploring our own interests as well. Yeah,
Mhm.
yeah. Okay. And so sacred medicine and your course, you called it Return to Roots, a self-development course for psychedelic inspired nurses. So can you tell us a little bit about the course, or maybe go backwards a little bit and tell us like how this even originated?
Sure.
This,
Yeah,
yeah.
absolutely. So a couple of years ago, I wrote a paper for the American, co-authored a paper for the American Journal of Nursing with Billy Rosa, Carolyn Dorson, and Andrew Penn, who are all great leaders in psychedelic nursing. And it's actually the first article on psychedelics in AJN since the 60s.
Mm.
And we actually kind of reference that 1960s article in our article, which is cool.
Before you keep going, I want to just say, can you send us a link and I can put this in the show notes so that people can read this article? Thank you. Yes.
And so um, in that article, we had kind of recommendations for how nurses can get more involved. And one of the recommendations was like to pursue continuing education in psychedelics. And I realized there's nothing out there for nurses. There are programs for professionals, like some of them are more cross-disciplinary, or some of them are specifically for psychologists or therapists, maybe, or doctors, but there's nothing out there for nurses. So I created a very small course called Nursing and Sacred Medicine. And it's just a three week introductory course where we cover sacred medicine traditions, current clinical research, and um, holistic nursing as a foundation. And that was a great experience the first time I created like an educational course. And
Yes.
I did that with my co-founded it with my friend Naku Kiwa. So that was a really lovely experience for us. And we got to engage with nurses and see how much of a hunger there was for this information. And that course is still available as a self-paced learning
Oh,
as
good. Hopefully you'll send us that
structure.
link. We'll put that into the show notes too.
Yep.
Yeah.
But my I kind of realized, let's keep going with this.
Yeah.
And I my thought actually was maybe it's time to create a psychedelic nursing certification program, which is that's a big leap. I actually teach for a program called Synthesis Institute, which is a psychedelic practitioner training program for both licensed professionals and unlicensed. It's very cross-disciplinary, wide-ranging. It's a great program. But I've been thinking that I would love to develop something nursing specific because nurses are coming to this work with
Hmm.
a very specific lens and background and education and experience. Um, and I think just to kind of sidetrack a little bit, I think nurses are so well suited for psychedelics and we bring so many skill sets that other disciplines don't. And no, I don't think any one discipline has it all, but I think we bring a really important piece of the puzzle. And if you think about it, nurses are with patients in non-ordinary states of consciousness, sometimes every day. If you're a hospice nurse or working in labor and delivery, if you're in psych, if you are working with patients coming in and out of anesthesia, patients with delirium, um, like so many reasons why somebody could be in an altered state or even just shock trauma, emergency nursing. So, and nurses often are with patients for prolonged periods of time, offering their caring, healing presence. And another aspect that really came to me as we were developing this newer course is the emphasis on the healing environment. Because in psychedelic care, that's conceptualized as set and setting, especially the setting aspect, how the mindset that you're going into, and then also the environment that that you're surrounded with in a psychedelic experience, the physical environment, the environment of the practitioners with you, of their presence. And then beyond that, the energetic environment can really have an impact on the experience. And nursing is a profession that studies and practices with the healing environment. And so that was another important element that I think we bring to the table. And so my thought was to create a practitioner training program. And I also noticed that there's a little bit more available for NPs who have, like, especially psych NPs who can practice therapy, psychotherapy, but less out there for RNs. And as an RN, I was served on the psilocybin cancer anxiety project as a guide. I was quite capable of doing that. And I mean, I did it, I had a partner with me that I worked with who was a psychiatrist, but I certainly had an important role. And I really firmly believe that RNs have an important role and that you don't need to have an advanced degree to be in this field. And so I sought out a collaborator to work with who is Angela Ward. She is a really experienced psychedelic nurse coach. She's a nurse coach as well and uses the nurse coaching model to work with clients who are using ketamine therapy. So she partners with a prescriber, but she does kind of all of the intake and educational process and preparation, the dosing sessions, and the integration sessions with the client using that nurse coaching model, which I think is very pioneering of her. And so we came together to see what we could create. And we thought, okay, our ultimate goal might be to make a practitioner training program, which we would like to ground as also a nurse coaching program. But let's make something intermediary. So we are offering this course, which is called Return to Roots, a self-development course for psychedelic inspired nurses. We just finished our first cohort. We had 13 nurses. It was such a wonderful experience. We had nurses from all different backgrounds, RNs, NPs, one new grad, some retired nurses, all different, all different experiences like psych, OR, oncology, everything. People coming with some holistic nurses and some nurse coaches, and people coming with just so much rich experience to offer. And it was so moving for Angela and I, but it was also really moving for the participants. They all expressed, like, really every single one of them expressed having received a lot out of it. So that was really gratifying for us. And we're really excited to continue with our next cohort. Enrollment, well, it begins on October 2nd and enrollment ends on September 25th, as a FYI. But a little bit more about the course itself. Basically, it is a course that is grounded in holistic psychedelic nursing, which is basically a discipline that we're creating as we go, as that we're developing. I feel like nursing in general has a lot of catching up to do when it comes to psychedelic nursing and creating that framework, that theoretical groundwork for that discipline. Other disciplines like psychology or medicine are much further ahead. And in particular, we feel that holistic nursing is the right or is a right specialty to lead the way in this. Because, I mean, I think psych nursing is really relevant, but holistic nursing really takes into account caring, healing presence, and also self-reflection and self-care and holistic approach, like approaching. I mean, most of these psychedelic sacred medicine experiences for people, experientially, they occur on so many different dimensions. They can occur on the spiritual dimension and the relational dimension. And holistic nursing actually provides some framework and some language to be able to work with people in those dimensions. And so we think it's a perfect match. Our course is basically, it's 10 weeks. We have 4 in-person, 2 hours live online meetings, and the rest is asynchronous. And there's a lot of community interaction within the course, like commenting on each other's posts.
Mhm.
There's a self-development piece, which is a commitment to doing at least 10 minutes a day of self-care practice 5 days a week throughout the course and being accountable for that. And there's a lot of self-reflection, which is my favorite part of the course, prompts
Yeah.
to help you think about your own path, your own history, what you're bringing to this work, and how it might apply. So we go into a lot of different elements. We talk about just psychedelic nursing. We talk about the history of sacred medicines and sacred medicine traditions from an indigenous perspective, which I think is so important to lead with
Mhm.
because these practices didn't originate in the 1960s. They've been held for centuries and millennia by
Yeah.
medicine carriers and traditions. So we honor those traditions and provide some education about that and really look into some of the threads of those traditions that we can learn from. We talk about, we encourage people to look at their own traditions and their own ancestral roots. And that's part of the reason it's called Return to Roots, looking at some of the healing traditions that you might have in your background. And we together look at if you even go into modern Western medicine and you dig back and back, we have a more holistic, shared healing tradition that, if you look into medieval medicine, we look particularly at Hildegard von Bingen as an example of medicine that incorporates the four elements, that incorporates mind, body, and spirit, that honors plants. And so we go into that. We do talk about the four elements as kind of a foundation for a nature connected and spirit connected practice. And then we talk about creating self-development, yourself as a healing vessel, as a touch point for people and the self-work that's required for that. We talk about the healing environment as a really foundational element, like I mentioned already, then putting it all together into a healing encounter. And then we had talk about ethics throughout, but we focus on ethics and reciprocity and accountability in community. So those are kind of the modules. And um, this course, one thing I'd like to just touch on is like, who is this course for? So we saw in our first cohort that it really can work on multiple levels. It can be for people who are already in practice, working with psychedelics, working with ketamine, working on clinical trials or what have you. And we had some of those nurses in our course, and they were longing to have more of that nurse-oriented experience in that nursing community. Could be for somebody who's looking into becoming a practitioner, and this is like a good step along the way of self-development. Could be somebody who knows they want to participate in the field, but maybe not as a practitioner, but maybe as an advocate, as an educator, as an ally of some sort. And so this course is like also inviting that not everyone has to be a psychedelic practitioner, but there's lots of work to be done that we can participate in.
Mm.
And then lastly, it could just be for somebody, a nurse who has had their own psychedelic healing experience, people who have maybe gone to a retreat center in another country where it's legal, or participated in a clinical trial, or worked with ketamine, and had a life-changing experience, maybe a soul and spirit expanding experience that really puts them in connection with a lot of different possibilities, of of healing and of connection with people. And then they go back into their work as a nurse and they might feel like a real disconnect from those two worlds. And it can be quite difficult to go back into a modern paradigm of healthcare that sometimes doesn't allow as much space for the whole person. And now you have had these expanded states, and what do you do with that as a nurse? So it's really to help people see how they can apply it in their own nursing role, wherever they are, apply the lessons that they've learned. Or maybe they need to shift into a different role, but it's allowing space to explore that. So it's really for all of those types of nurses. And it's, like I said, the first experience was really magical. It was a magical coming together, and we're really excited to keep it going with further cohorts, see who out there this work is for.
That's right. This is the topic that is not new, as you mentioned. This going back generations and generations and generations using plant medicine, sacred medicine rituals. Um, and yet today's society, we have, oh, so, excuse Bumpy while he goes by. In today's society, some people think that this is not medicine, and
Mhm.
just it being illegal in some areas. And there's a shh,
Yeah.
keep that quiet. So tell us your thoughts on that, and how you've decided to just like, I'm going to stand up. I'm going to be a voice for this.
Yeah,
Yeah.
absolutely. Well,
Hmm.
there definitely is a stigma for sure for a lot of
Hmm.
people. Um, and especially within healthcare, where you have to be really careful about your license and making sure that everything that you do is legal and ethical. Um, these medicines were criminalized for LSD and psilocybin in the 60s or 1970 with the Controlled Substances Act and with MDMA in the 80s. And um, there was a lot of promising research at that time um, around especially psilocybin and LSD. And the research that is happening now is really just building on that research, maybe with somewhat stronger research paradigms. But a lot of the clinical practices and approaches were developed then. But because underground use caused a lot of shifting of cultural norms that and there was a number of factors that went into them being criminalized or becoming scheduled medicines. And they never went away. People have been using them underground for a long time. And I think that's really important to recognize, actually.
Hmm.
Caroline Dorson has done some really wonderful work. She's a nurse researcher of kind of along a harm reduction framework of talking to people who participate in, let's say, sacred medicine underground ceremonies with ayahuasca and getting their stories and how they conceptualize that work. Like, for example, that they don't look at it as a drug, that some of them are using it in order to get off or stay off drugs. That, other drugs, other substances that have been harmful to them, where they find that this substance is helpful to them and healing to them. Um, so in the last 20 years or so, the door has reopened into research, and there's been a lot of research on psilocybin, mostly psilocybin and MDMA. So both have been fast-tracked by the FDA as promising treatments, psilocybin for depression and treatment-resistant depression, and MDMA for post-traumatic stress disorder. And these are two huge mental health diagnoses that, has touched somebody that every one of us knows and don't always have a lot of great treatments or treatment outcomes, at least not for everybody. Um, MDMA for PTSD, just what Lykos is just a pharmaceutical company associated with MAPS, Multidisciplinary Association for Psychedelic Studies, just went through the application process for MDMA to be rescheduled or to be, for them to be able to move forward with MDMA legally through the FDA, get FDA approval. And it was denied, this was just in August. This was a huge surprise in a lot of ways and a big blow to the movement. It doesn't mean that it's over. The FDA made recommendations for them to conduct another phase 3 trial and then reapply. And so, um, there's a lot of researchers out there, medical researchers, that are taking this very seriously and putting it through all the same procedures that any other medicine or drug has to go through. Um, and there have been really good outcomes for PTSD remission, and really good outcomes for remission of treatment-resistant depression for both of these. But maybe we're still, building that really robust evidence base and continuing to move into those phase 3 trials to show that it's replicable and scalable and appropriate for a larger population. And there are a lot of safety considerations, absolutely a lot of ethical considerations. Um, like one, for example, is when Lycos brought this application to the FDA, it was not just as a drug, it was as a drug conjoined with therapy. And they have a certain therapeutic model that it's recommended to be paired with, or that it would have to be paired with. It's a very liberal model where lots of different types of practitioners could fit into it, but there is a manualized treatment model. And that's really new for the FDA. That's one of the reasons that it wasn't approved because they're not used to approving drug and therapy together.
Mm.
Um, because these medicines are so powerful, so life-changing, that it's not recommended for someone to just be prescribed to take it home by themselves.
Right.
It's not recommended. These are sometimes people call them ordeal medicines. It's something that, you go through an experience with this, especially psilocybin or LSD or ibogaine or something like that. And it's recommended to have preparation, to have somebody accompanying you on the experience, and to have somebody help you to integrate the experience. There's also a lot of ethical concerns regarding the practitioners. There's a lot of heightened possibility for transference and countertransference. There's a heightened possibility of therapists having their own ego inflation or taking advantage of clients. There's unfortunately a history of that happening, sexual abuse happening both underground and unfortunately in clinical trials. And that's a very real thing we have to look at. And not that that doesn't happen in ordinary therapeutic settings as well, but I think the risk is higher with these medicines. So I'm definitely a proponent of looking at the risks and benefits of taking the risks seriously. But the only way we can really do that is if we keep moving it forward, if we bring these medicines above ground and we agree together as a society that we're willing to try to work together to manage those risks. We do risky things in medicine all the time, and it
Mm.
doesn't mean that we don't do them. There's informed consent and there's people who will be willing to take those risks and people who it won't be appropriate for.
Right. Yes, we definitely do a lot of risky things in medicine. And we combine it with the informed consent. So, yes, we're not just doing things willy-nilly. So we were talking about risks in medicine, the risks that we take in medicine, and that bringing psilocybin out from the underground would help
Hmm.
to mitigate a lot of that risk as well.
Hmm.
Yeah.
Yeah, I mean, I think for me, I have like these two ways of looking about it. One is the nurse, scientist, researcher, evidence-based kind of mindset of it is good that we're going through the proper ways of proving these therapies are safe and effective, just like we would any other medicine, any other medication, any other treatment. And then the other part of me is kind of more on the ritualistic spiritual side, which says that these medicines have been used for thousands of years already.
Yeah.
Some of them, like psilocybin, for example, or ayahuasca, iboga, peyote. And um, part of me definitely favor, well, actually, not part of me. I wholeheartedly favor a decriminalization approach. I think that it's good for the medical community and the psychotherapy community and the nursing community to be looking at how these work in that model, but also not to limit it completely to that model because that kind of becomes a social justice issue. I mean,
Mm.
these medicines have belonged to people who have
Yeah.
used them ritualistically and spiritually, and I don't think we should just limit it to medicine. Also, that kind of limits just the multi-dimensional nature of these medicines and kind of puts them into this box of this cures that, which is so much of what the problem in our approach in modern medicine has been anyway. And maybe we can use these to kind of move into a different, more holistic, more transcendental paradigm when it comes to mental health. I mean, even that term mental health to me seems so one-dimensional. Makes you think about something with your brain when it's really so like, something like depression touches and is touched by every aspect of somebody's life. And a
Yeah.
lot of our society's ills, in my opinion, are social ills, are coming from loneliness, are coming from lack of connection, are coming from disparities in health and access to clean air and clean water and clean food and things like this. And so I'm hoping that these medicines won't just be another pill,
Mm.
won't just be another treatment, but will help us to, I mean, they tend to be mind expanding, consciousness expanding. They do create neurogenesis in the brain. They do kind of create new neural pathways, and I'm hoping that they can allow us to create new paradigms as well in healthcare that are a little bit more expansive, connected, and holistic.
Mm. Yeah, that that sounds amazing because of what they do, it should also reflect how they're going to be used and
Mhm,
utilized within
mhm,
the whole expansiveness of our world. So,
mhm.
wow,
Yeah.
very, very
For example,
fascinating.
like one practical way that we could do this is just look at more community-based models,
Mhm.
and seeing that when people have these experiences supported in a group context, which isn't appropriate for everybody. Some people benefit more from one-on-one, but a lot of people, the group context is incredibly beneficial with that community support, that connection, that having reflections of other people, learning from their experiences, being seen, being witnessed. So that kind of honors some of the more traditional ways of working with these medicines in a community context.
Mhm.
And it allows them to potentially be more economical models of care, which then can allow greater access and equity, which is really important.
Absolutely. Yes, I love group coaching and the
Mhm,
group coaching and group community programs, all of those things because of
mhm,
those amazing um, attributes.
mhm,
We do have another podcast guest who spoke on about psilocybin and the work she's been doing. So I'm just going to put a plug in here for episode 69. It's called Combining Psilocybin Education and Nurse Coaching. And that was with Chandra Campanelli, Assisi Campanelli. I'm going to put her podcast into the show notes too, so people can listen to another perspective on using psilocybin as a guide with psilocybin in the journeys that people take. So it was interesting.
mhm,
Also fascinating. And like I said, this is a newer world for me. And I know for a lot of our listeners, it's a newer world. And so we're so grateful for how much information and just having us think differently about something that has been criminalized, and
mhm,
it is a taboo subject. And we're trying to elevate it so that we are not fearful.
mhm.
And this isn't a fearful it's plants. It's
Mhm.
things that are and have
Yeah,
been used for thousands of years, like you
yeah.
mentioned.
Well, we
Yes.
are we are afraid of plants. I mean, in our
But they're
medical,
everywhere.
they're
you know?
everywhere, and they're our
Yeah.
birthright. It's our birthright to know how to work with the medicines that grow in our backyard. And
Yes.
yet so many of us are really disconnected with that, and we are
Yeah.
fearful of plants in modern medicine because they're not as controllable, they're not as marketable, many different reasons.
Mhm.
And that's part of the course. That part of the course is specifically exploring your relationship with plants and plant medicine, not just this grand consciousness altering medicine, but also common plants that might be weeds growing in the sidewalk that might still be able to help alter your consciousness in a more subtle way, or just provide different nutritional benefits, or so many things
Yeah.
can that we can do when we connect with plants.
Yeah. I love this. Maybe I'm signing up for your course, Stephanie.
I'd love it. We'd love to have you.
Yes. So we have a few moments left. I'd love to ask one question that's every guest who has been on our podcast has answered. And the question is, what is on your heart that you would like to share with our listeners?
I think that, I mean, the work that Angela and I are doing is focused on psychedelics, but at the root, it's not really even about that. It's about nurses connecting with their hearts and connecting, creating a heart-centered practice. And that's what we're really wanting to emphasize. And so many people come into this work because they have a lot of empathy, they love people, they like using their hands to help, they have an attitude of service. And sometimes in our modern paradigms, that's not nurtured enough. And also with all the constraints that we have and kind of the financially driven motives that are unfortunately a reality, like a lot of that just gets kind of ground down, or there's not enough space for it to be nurtured and developed. And so that's what we're trying to do here is helping nurses connect with their own hearts, their own passions, their own integrity, their own sense of even right and wrong in their own practice. Um, so I don't know. I think we kind of look at the balance of both what nurses have to bring to psychedelics, psychedelic therapy, psychedelic care, and also what psychedelic care can bring to nurses and how it can help
Mm,
us reconnect with the heart of our practice.
thank you. So, how can people find you when they're looking for you to ask some questions about your course or your course?
Sure. So our course page is holisticpsychedelicnurse.com/return to roots.
Okay.
And our Instagram is HP Nurse Collective, Holistic Psychedelic Nurse Collective. Um, I'll certainly give you a couple of resources in the show notes for articles, and
Yes.
there's a short film that I was in about psilocybin at end of life and some other resources for people to explore.
So, you're a movie star too?
I, I don't know, I'm not that camera shy, so
I love it.
I
Yes,
like
we'll
talking to
definitely get
people.
all of these links, put them
Yeah.
in the show notes so people can go there and see what you're up to, connect with you on socials, and if this course is calling to them to find out a little bit more. Yeah.
And yeah, or to reach out to us, ask us
Yeah.
questions, and
Yes.
we're happy to talk with you more, or just share with a colleague that you think might be interested.
Mhm.
Our next cohort, like I mentioned, starts October 2nd. The deadline is for sign up is September 25th, and then our following cohort will be in February.
Okay. Yes. All right. Well, thank you so much, Stephanie, for sharing your wisdom. So many pearls of goodness came out of that our interview and time together today.
Mhm. Thank you. Thank you for elevating these conversations with nurse coaches. I love it.